Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, welcome to our clinic. How can I assist you today?
Good morning, doctor. I've been experiencing some concerning symptoms lately and I'm quite worried. I've been having severe headaches and some episodes that I can't quite explain.
I'm sorry to hear that. Let's go through your symptoms in detail. Can you describe these headaches and the episodes you mentioned?
The headaches are intense, like a pulsing sensation on one side of my head. They happen a few times a month. The episodes are different. It's like I suddenly can't understand what people are saying to me, and I feel very detached from my surroundings.
How long have these symptoms been going on, and have you noticed anything that might trigger these episodes?
They started about 6 months ago. Stress seems to make both the headaches and the episodes worse. Also, I noticed that lack of sleep tends to trigger the headaches.
Do you have any other symptoms during these episodes? Any muscle twitches, changes in vision, or difficulty speaking?
Yes, I sometimes find it hard to speak properly during these episodes, and I have experienced twitching in my left arm as well.
Based on what you're describing, we need to consider a couple of possibilities, including migraine headaches, which could explain the severe headaches, and something like temporal lobe epilepsy, which might explain the episodes of altered understanding and muscle twitching.
That sounds serious, doctor. What kind of tests do we need to do?
I'd recommend starting with an MRI of your brain to look for any structural issues, and an EEG to check for any abnormal brain activity that might indicate epilepsy. Blood tests to check for underlying infections or metabolic issues would also be helpful.
What are the treatment options if these tests confirm your suspicions?
For migraines, we can look at various medications to help prevent the headaches or stop them when they occur. If it turns out to be epilepsy, there are several medications that can help control or reduce the frequency of the episodes. Lifestyle changes will also be important, particularly managing stress and ensuring you get enough sleep.
I've also been feeling really down lately, more so than usual. Could this be related to the headaches and episodes?
Absolutely. Chronic pain from conditions like migraines can lead to depression. Also, dealing with the unpredictability of epilepsy can be quite stressful and could definitely impact your mental health.
What can we do about that aspect?
It's important to address this holistically. I would recommend seeing a psychologist to help manage the stress and possibly starting on an antidepressant if necessary. Regular exercise and a healthy diet can also improve both your physical and mental health.
I feel overwhelmed, doctor, but I'm glad we're identifying what might be wrong.
It's completely normal to feel that way given the circumstances. My goal is to help you manage these symptoms effectively and improve your quality of life. We'll take it one step at a time.
Thank you, doctor. When do we start with the tests and treatment?
We can start today with the blood tests and schedule the MRI and EEG as soon as possible. I'll also arrange for you to meet with our psychologist to start addressing the mental health aspects right away.
That sounds like a plan. Thank you for being so thorough.
Of course, I'm here to help, and we'll navigate this together. I'll see you again soon to discuss the test results and next steps. Please feel free to reach out if you have any questions or concerns in the meantime.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Mrs. Thompson. How have you been feeling lately?
Hello, doctor. I haven't been feeling well at all. I've been having this persistent cough and shortness of breath for a few weeks now. It's getting worse, and I've also started to lose weight without trying.
I'm sorry to hear that. Weight loss and persistent cough can be concerning. Have you noticed any other symptoms, such as fever or night sweats?
Yes, I've had some night sweats and occasional fevers. I thought it was just a flu that wouldn't go away, but I'm starting to get worried now.
I understand your concern, Mrs. Thompson. Given these symptoms, we should consider some serious conditions, including infections or possibly a neoplastic disease like lymphoma. We'll need to perform some diagnostic tests to better understand what's happening.
Lymphoma? That's a type of cancer, isn't it? What makes you think it could be that?
Yes, lymphoma is a type of cancer affecting the lymphatic system. Your symptoms of persistent cough, weight loss, night sweats, and fevers are classic symptoms associated with lymphoma, particularly Hodgkin's lymphoma. However, these symptoms can also be caused by other conditions, so we need to do further testing to be sure.
What kind of tests are we talking about? I want to get to the bottom of this as soon as possible.
We'll start with a complete blood count to check for anemia or signs of infection, and an erythrocyte sedimentation rate to check for inflammation. We'll also need a chest X-ray to look at your lungs and lymph nodes. Depending on those results, a CT scan or even a lymph node biopsy might be necessary.
How soon can we get these tests done?
We can start with the blood tests and the chest X-ray today. The CT scan can be scheduled as soon as we have the initial results. If we need a biopsy, I'll refer you to a specialist.
And if it turns out to be lymphoma, what are the treatment options?
Treatment for lymphoma can vary depending on the type and stage, but it generally includes chemotherapy, radiation therapy, or a combination of both. There are also newer treatments like targeted therapy and immunotherapy that have shown promising results. The goal is to destroy the cancer cells and prevent them from spreading.
I see. And what about the side effects? I've heard chemotherapy can be quite harsh.
That's a valid concern. Chemotherapy does have side effects like fatigue, nausea, and an increased risk of infections, among others. However, there are effective ways to manage these side effects today. We also tailor the treatment plans to each patient's specific situation to minimize discomfort and maximize effectiveness.
This is a lot to take in. I'm feeling quite overwhelmed.
I completely understand, Mrs. Thompson. It's normal to feel this way. I'm here to support you through every step of this process. You won't be alone. Our team will provide all the care and information you need.
Thank you, doctor. That does make me feel a bit better. How should I prepare for the upcoming tests and potential treatments?
For now, focus on maintaining a balanced diet and staying hydrated. Rest as needed, and try to keep a positive outlook. We'll handle each step as it comes, starting with the tests. Once we have a clear diagnosis, we'll discuss everything in detail regarding the treatment options.
All right, I trust your judgment and appreciate your support. Let's proceed with the tests and see what we find.
Absolutely, Mrs. Thompson. We'll start today, and I'll update you as soon as the results come back. We're here for you every step of the way.
Thank you, doctor.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hi, Mark. I noticed you're scheduled to lead the diabetes management workshop today. How are you preparing?
Yes, I'm setting up now. It's important to emphasize lifestyle changes along with medication adherence. Many patients struggle with the dietary aspect.
Absolutely. I've seen better outcomes when we involve family members in the education sessions. Do you think that could be included in your workshop?
That's a great idea, Emily. Involving families can definitely provide better support systems for our patients. I'll add a segment on that. Thanks for the suggestion.
Now look at question 26.
Morning, Lisa. How was your night shift? I heard Mrs. Johnson had a tough night.
Hi, Tom. Yes, she was quite disoriented and had a few episodes of agitation. Delirium in elderly patients can be challenging.
It really can be. Did the environmental modifications help at all?
Somewhat. Dimming the lights and reducing the noise seemed to calm her a bit. I also used some orientation techniques that we discussed last week.
Good to hear those helped. Let's review her medications and hydration status too. Sometimes small adjustments there can make a big difference.
Now look at question 27.
Dr. Carlson, the young patient in Ward 3, is experiencing a severe asthma attack. We've administered the first dose of nebulized salbutamol, but there's minimal improvement.
Thanks for the update, Nurse Andrews. Let's prepare for a possible second dose and check her oxygen saturation again. Have you reviewed her asthma action plan?
Yes, I have. Her plan indicates a history of hospitalizations due to asthma. I think we should also be ready to administer systemic corticosteroids if there's no significant improvement soon.
Agreed. Keep monitoring her closely and update me in 15 minutes. If her condition deteriorates, we may need to consider escalation.
Now look at question 28.
Dr. Bennett mentioned in today's briefing that we're shifting our pain management protocol. Are you familiar with the changes?
I've glanced through the new guidelines. They emphasize non-opioid treatments more heavily and introduce new criteria for patient evaluation. How do you think this will affect our post-operative care?
It should actually improve how we manage pain. By using a multimodal approach, we can potentially reduce reliance on opioids and minimize side effects. I think it's crucial we all get trained on these new protocols.
Absolutely, I agree. Minimizing opioid use where possible is beneficial for patient recovery. I'll organize a session for the nursing staff to discuss these changes in detail.
Now look at question 29.
Dr. Miles, the new patient in bed 9, Mrs. Amelia Benson, was admitted last night with signs of a stroke. She has left-sided weakness and speech difficulties.
Thanks, Nurse Thompson. Did the CT scan confirm the stroke location and type?
Yes, it's an ischemic stroke. We've started her on IV thrombolytics. Her family has been notified, and they are on their way.
Excellent. I'll review her medication history and see her shortly. Please keep monitoring her vitals and neurological status closely.
Now look at question 30.
Good morning, Dr. Sanders. We have several new patients this month with chronic conditions requiring mental health support.
Morning, Eric. Yes, managing the psychological impact of chronic illnesses like diabetes and heart disease is crucial. Are we coordinating with our mental health team?
We are, and I've arranged for a joint session next week. It might help if we create a regular schedule for these patients to meet with a counselor.
That sounds like a good strategy. Keeping mental health as a priority can significantly improve their overall treatment outcomes. Let's ensure our staff is also trained to recognize signs of mental distress early.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Good afternoon, everyone. Welcome to our educational webinar on managing type 2 diabetes in the elderly. I'm Dr. Thompson, a geriatrician specializing in diabetes care. Today, we will delve into the complexities of diabetes management in older adults and discuss a case study that illustrates these challenges.
Hello, I'm Dr. Evans, an endocrinologist with a focus on late-onset diabetes. I'm excited to join this discussion and share insights on how healthcare professionals can optimize treatment strategies for this population.
Let's begin by discussing the unique aspects of managing diabetes in the elderly. Elderly patients often have different physiological considerations, which can complicate the standard diabetes care model. For example, renal function decline, cardiovascular health, and cognitive impairment all play critical roles in treatment decisions.
Absolutely, Dr. Thompson. The presence of comorbidities often requires a tailored approach to diabetes management. Polypharmacy, or the use of multiple medications, is another significant concern. It can lead to increased risks of hypoglycemia and other adverse effects, which are particularly dangerous in the elderly.
To illustrate these points, let's discuss the case of Mr. Jacobs, a 78-year-old man diagnosed with type 2 diabetes at the age of 73. Mr. Jacobs also has hypertension, mild cognitive impairment, and a history of a transient ischemic attack. His treatment regimen includes metformin, a low-dose sulfonylurea, and antihypertensive medications.
Mr. Jacobs' case is a good example of the balancing act required in managing elderly diabetic patients. His cognitive issues present challenges in maintaining dietary recommendations and medication adherence, which are crucial in managing his diabetes effectively.
Exactly, and his family reported that he had experienced several episodes of mild hypoglycemia, possibly related to his inconsistent meal patterns and the sulfonylurea. After reviewing his case, we decided to simplify his medication regimen to reduce the risk of hypoglycemia. We discontinued the sulfonylurea and adjusted his diet plan to better accommodate his lifestyle.
This decision underscores the importance of individualized care plans. In Mr. Jacobs's case, frequent monitoring and adjustments were necessary. We also involved a dietitian to assist with meal planning and a nurse specialist to help manage his blood glucose levels.
Incorporating interdisciplinary care is critical. Also, we must consider the psychosocial aspects of diabetes care. Mr. Jacobs lives alone, which raises concerns about his safety and the ability to manage diabetes complications effectively. We arranged for a home health aide to visit him weekly and set up a telehealth schedule for regular check-ins.
Telehealth has become an invaluable tool, especially in the management of chronic diseases in elderly patients who may have mobility issues. It provides an ongoing connection with the healthcare team and ensures that patients like Mr. Jacobs receive timely care without the need to travel.
Absolutely. Now, based on our experience with cases like Mr. Jacobs, it's clear that managing diabetes in the elderly requires a flexible, patient-centered approach. It's not just about controlling blood sugar, it's about integrating care across disciplines and considering the patient's quality of life.
And to all healthcare professionals listening, remember that the goal of diabetes management, especially in the elderly, is to minimize complications and maximize quality of life. Each patient's goals and capabilities should guide the treatment plan.
Thank you, Dr. Evans, for those insightful comments, and thank you to everyone who joined us today. Remember, effective diabetes management in the elderly not only requires careful consideration of medical factors, but also a compassionate approach that respects the individual's lifestyle and preferences.
Thank you, Dr. Thompson. It's been a pleasure discussing this crucial topic with you and our audience. Stay informed and proactive in your practice, and let's continue to work towards better health outcomes for our elderly patients with diabetes.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, I am Dr. Lucas Martin, a cardiologist with a specialization in the management of complex heart failure cases. Today, I will discuss the multidisciplinary approach to managing advanced heart failure, focusing on a case study that underscores the challenges and innovative strategies involved in treating such complex cases. Heart failure remains one of the most challenging health conditions globally, often requiring a nuanced and highly collaborative treatment approach. As cardiologists, we often need to engage with a variety of healthcare professionals to effectively manage heart failure, particularly when patients present with advanced stages of the disease. The case in question involves a patient whom we will refer to as Mr. Smith, a 58-year-old male diagnosed with stage C heart failure characterized by reduced ejection fraction. Mr. Smith's journey is a quintessential example of the intricacies involved in managing advanced heart failure and the importance of an integrated care pathway. Mr. Smith was initially referred to our clinic with dyspnea, fatigue, and reduced exercise tolerance, which had progressively worsened over 6 months. His medical history was significant for diabetes mellitus and hypertension, both of which are risk factors for heart failure. An echocardiogram confirmed a left ventricular ejection fraction of 25%, significantly lower than normal, suggesting severe cardiac dysfunction. Given the complexity of his condition, we initiated a multidisciplinary team approach. This team included a cardiologist, a heart failure nurse, a dietitian, a physiotherapist, and a social worker. Our initial focus was to optimize Mr. Smith's pharmacological treatment, which involved titrating his doses of ACE inhibitors, beta blockers, and diuretics, guided by current guidelines and his specific clinical response. Parallelly, the heart failure nurse provided Mr. Smith with comprehensive education about self-management strategies for heart failure, including monitoring his weight and fluid intake, adhering to a low-salt diet, and recognizing signs of exacerbation early. The dietitian tailored a nutritional plan to manage his caloric and fluid intake, vital for preventing fluid overload, a common complication in heart failure patients. Physiotherapy played a crucial role in improving Mr. Smith's functional capacity. The physiotherapist developed a graduated exercise program that was both safe and effective, aimed at enhancing his overall physical stamina and heart function. Social work involvement ensured that Mr. Smith had access to community resources and support, facilitating his adherence to treatment and follow-up appointments. After 6 months of rigorous and coordinated care, Mr. Smith showed remarkable improvement. His symptoms had reduced significantly, and follow-up echocardiography indicated an improvement in his ejection fraction to 35%. More importantly, his quality of life had vastly improved, and he was able to return to many of his previous activities, which was one of the primary goals of our intervention. This case exemplifies the potential of a multidisciplinary approach in managing complex heart failure. By integrating the expertise of various healthcare professionals, we were able to address not only the physiological aspects of heart failure, but also the educational, psychological, and social dimensions that are crucial for comprehensive care. Mr. Smith's case is a testament to the efficacy of multidisciplinary management in heart failure. It highlights the importance of a coordinated approach in improving clinical outcomes and enhancing the quality of life for patients with advanced heart failure. Our experience with this case provides valuable insights that could be translated into broader clinical practices and guidelines, reinforcing the need for collaborative, patient-centered care in the management of complex health conditions.